guys, welcome back, Previa Alliance. Sarah and Whitney here. And again, we had such an awesome conversation with Emily about what to do in pregnancy with pelvic floor. Yep. We brought her back for postpartum series.
That's right.
Emily, thank you again.
Yay.
So happy to have you. So tell us all things postpartum. What do you think? What do women need to know?
All right. First of all, this is my biggest soapbox.
Hey, we love it.
Because this is an orthopedic issue, right?
Yeah.
And we treat our ankle sprains better than we treat our postpartum moms, right? So if you
do. It's ridiculous.
If you have a standard knee surgery, somebody's going to be seen at 2 weeks, at 6 weeks for progression of rehab, at 12 weeks for return to sport. If you have a postpartum mom, they're like, we see you in the hospital. We see you at 6 weeks. See ya.
See you in a year for your
And
ankle.
then nobody asks, like, how'd that go?
Yeah.
Like, go resume everything. And then nobody's checking to be like, did that go okay for you?
Yeah.
Did you have any issues?
Right.
And I think societally, it's kind of expected that women are going to have issues.
Yeah.
And so, like, the lines get blurred between what is normal and what is typical. So it's kind of expected, like, oh, you had a baby, like, of course you can't run without peeing your pants, or like, sex is gonna hurt. You had a baby. What did you expect?
Right.
And those issues are typical because our postpartum care in this country is abysmal, but they are not normal.
Yeah.
Okay.
And they can be treated.
Yeah.
There's a difference between common and normal.
Exactly. So, like, what is typical doesn't have to be tolerated.
Oh, I love it.
That's
Right.
Yes.
So, like, we see a multitude of issues, and we're going to kind of cover some vaginal and cesarean birth issues. So some kind of heavy issues that we hit in the postpartum period is issues with intercourse, right?
Okay.
So sometimes it's very painful, right?
Yeah.
And that can be to the extent that it just cannot be done. And so, like, we'll see this a little bit more with our vaginal births, right? So, like, sometimes there's tearing that occurs during birth, and
God love you mamas that have a 4th degree.
bless it, right?
Yeah.
If you have a 4th degree and your provider has not suggested therapy, like, please reach out, find somebody. Even if you don't have one in your area, people do virtual visits, and they could probably
That's really cool.
Good to know.
help
Okay.
you, because that's very extensive.
Yeah.
That's a full thickness muscle tear.
Yeah.
So we can have tearing, and scar tissue fills into those tears, and scar
Yeah.
tissue is a normal part of healing, but scar tissue has to move.
Yeah.
So if scar tissue doesn't learn, hey, I need to move with these muscles as they're being stretched or contracted, the scar tissue can be a big limiter. So people, they're told at 6 weeks, like, all right, you're good to resume intercourse. And they're shocked when they're like, oh my gosh, this frill is freaking.
And then that's a whole mental health issue,
It
partnership
is.
issue,
Yeah.
self-confidence.
Oh, yeah.
And there's a multitude of factors that impact that.
Yeah.
I mean, breastfeeding, if you're breastfeeding, can make vaginal tissues very dry.
Yeah.
So we can have a lubrication issue. And so usually that's the blanket advice. It's just like, use tons of lube.
Or drink wine.
Oh, don't even get me started on that nugget of terrible advice.
I've heard that. Just relax,
yeah.
drink wine.
Well, I think a lot of times it's assumed that it's a lubrication issue, and that can be the case.
Yeah.
But then people are like, I use tons of lube and it still felt horrible.
Yeah.
And to me, I'm like, all right, then we probably have like a scar tissue or muscle issue. Stretching,
Yeah.
and they aren't.
Yeah.
Yeah.
So let's stretch them, and they don't necessarily need moisture. They just mobility.
Yeah.
Yeah.
Right.
Yeah.
And the drink wine and relax really ticks me off
It's
Yeah.
because
the
Like,
common
basically
blanket
just
advice.
go get tipsy and have sex. Like,
Yeah.
that doesn't
No.
actually solve the issue.
because it's still going to hurt.
and
Yeah.
and also, like, some people don't drink,
Yeah.
Yeah.
right? Or like
Yeah.
some
Exactly.
people take medications where they can't drink or
Yeah.
choose not to.
Yeah.
And some people, maybe can't have a glass of wine in the morning.
Yeah.
If that's their time.
Yeah.
Yeah.
They
Yeah.
like to connect. And I just
Exactly.
think it's the worst. And then
Yeah.
if they do that and it doesn't help, then they're just like, that was the only solution I was given. And I think that's
Have
terrible.
to sit here and live this. So sex does not have to hurt post baby.
Right.
So let's make that statement.
Yep.
And if it is,
Yeah.
we need to reach out.
So we
Seek
can
help.
have two issues, right? The first one is like we have issues with penetration. So either we can't achieve it, or it's painful,
Yeah.
or we can have issues with deep. Maybe insertion's not the problem, but deep penetration is, or there can be an inability to have orgasm or pain with that as
Yeah.
well. So those can be treated.
Okay.
Yeah.
You can do a lot of positional modifications. You can work on the scar tissue. You can help with the mobility of the pelvic floor. And a lot of times that gets significantly better. I also think it's important to note that research is showing a lot of the problems that we see postpartum, which are pain with sex, incontinence, or like leaking urine or poop or gas. If they're still present in 12 weeks, they're likely to be there at a year.
Okay.
So
Wow.
like, and that's
That's
what,
a big difference from 3 to 12 months.
yeah. So, you know, some people are just told to wait, like wait 4 months, wait 6 months. I'm like, no, if it's there at 12 weeks, it is likely to be there at a year.
Similar postpartum depression, anxiety. Like it doesn't
Absolutely.
just go away.
Right.
We
And
need
so
treatment.
Don't just wait it out.
Yeah.
Right. And so, and people that have a cesarean birth are often shocked because they're like, my vagina is supposed to be spared.
Yeah.
I didn't give birth that way, but a lot of
Yeah.
times
I felt the
it's-
same way. I felt that. I remember
Yeah.
saying that. I'm like, why is this happening?
Yeah. And
Yeah.
a lot of times they're really shocked because they're like, I'm not supposed to have these
Vaginal
issues.
issues.
Yeah.
I'm just supposed to be dealing with the weak core or
Yeah.
my abdominal wall or whatever. But especially the ones that labored for a while and then they ended up having, you know, a C-section that was unplanned or emergent. Like their pelvic floor got all those contractions with referrals from the contraction and didn't get any of the stretch of birth. So a lot of times it is
Wow.
tighter postpartum, so they can have issues as well. And they're like, I'm not even supposed to have this.
Yeah.
But they do. So,
And that's the thing. Our bodies are just connected to every other part of our body.
right. Yeah. And there's something to speak to birth trauma as well.
Well,
Yes.
You know,
Yes.
because birth trauma, I mean, that's real. And trauma
it is.
manifests in our tissues. And birth trauma, I think, sometimes is blown off of like, you're healthy, your baby's healthy. What is the problem?
gaslighting. Yes.
Yeah. But,
And the body keeps the
and
score.
the body is like, no, something terrible happened. And we're going to Fort Knox it down here so it never
Yeah,
happens again.
exactly.
I mean, that happened. I mean, it happened to me with our oldest. I mean,
Yes.
very traumatic C-section. And I had urinary pains.
Yeah.
And I remember going to the back and saying, this is not right. And then I actually did EMDR therapy for my birth trauma.
Good for you.
And I released that and it got better. Now,
Mm-hmm.
that I was holding it there, back
Yeah.
pain, whatever, that happened. So that's
Yeah.
very important to know is that our birth experience is going to come, like you said,
Yeah.
it holds in there.
It
Right.
does.
And so we need to, and sometimes you turn to OBs, you turn to your friends or your family, and you're like, they're like, we just had a baby, right? Like, this is to be expected. So these pains, these hurts, moms listening, voice them. If you're not hearing it, if you're not getting what you need from maybe OBs, friend supports, search out pelvic floor therapists. In our first episode of pregnancy, Emily broke down like how to find someone who's certified there, and she talked all about the pelvic floor. So please refer back to that one, and we'll link some notes too. But peeing on ourselves, let's just bring that up. Let's just get it out.
Yeah.
Are we supposed to?
Absolutely not.
Okay, because
Right. That is
So
typical.
motherhood does not mean you pee yourself.
because
Right.
that's like an ongoing thing. Like,
Oh.
you had a baby now, you pee on
And
yourself, right?
the worst part is, like, some fitness industries encourage it.
No, they do.
What?
Yeah, they do. They'll be like, ladies, it's a plyo day. Wear your pad. And I'm like, no, you are encouraging and enabling
I
pelvic
have
floor
legit seen that.
weakness.
dysfunction
Yes.
and weakness and poor,
Oh.
coordination.
Yeah.
So no, we should not. And that's one of those things that people are told to wait. Or,
They are.
it's told to be
Yes.
expected. But again, research shows if you're having incontinence at 12 weeks, you are likely to have it at a year.
So what can we do for that?
So it kind of depends because sometimes we can have one of two issues. Sometimes people can leak because they're on that tight side, and sometimes
Okay.
we're weak.
Yeah.
Just
Yeah.
like,
It's
things-
probably hard to tell that as like
the patient.
the patient. So
Right.
you need
And sometimes we can have a nice little combo. So
Yeah.
that's why like getting
Yeah.
evaluated is important.
Absolutely.
But I think that responds really well to treatment. And
Okay.
again, it's just that a lot of times after
Mm-hmm.
birth, that disruption of like our brain and our muscles, and we tell it where to go, it just gets interrupted. We think we're doing something, but
Yeah.
we're not.
yeah,
Got
yeah.
it.
And
Yep.
and normally, like before we had babies, we would get this reflexive contraction called the knack. So right before we cough, sneeze, we would get this like little pelvic floor contraction a millisecond before that, and we would
Stop
cough,
it. Yeah.
sneeze, and
Yeah.
that's why we never think about that.
Yeah.
when
Yeah.
we're 20.
Yeah.
right. But
Pre-kids.
that
Yeah.
gets disrupted when we have a baby
Oh,
because we
wow.
get a massive stretch of those areas,
Yep.
and then sometimes they're like, I forgot how to contract,
You have to teach it.
or I'm not
Yeah.
contracting at the right time. Right. And so some people will think
They
I'm
could
doing
contract post sneeze instead of pre sneeze.
right. Or some people will think I'm doing that, or I watch them cough or sneeze and they're actually like moving the opposite way. They're actually
They're,
like
like,
opening the
releasing the
doors.
floodgates.
That is the opposite of what we're going
And
for.
so, like,
people.
really, we just have to kind of like grade it, find out what they can do, and build up from there. Because sometimes it's
Okay.
coordination, like we're
Yeah.
just totally moving in the opposite direction. Sometimes it's endurance of like,
Yeah.
we can move that way for
Yeah.
5, but then by 7, we're fatiguing and we're leaking. So then that's kind of
Got
like gradually just like building up muscle strength anywhere else. We need power, strength,
Got
endurance, good
Okay.
coordination.
Probably consistency too with the exercises.
Right. So
Okay.
again, like research has shown incontinent women typically have poor coordination and use the wrong muscles at the wrong time. So again, we could be giggling at the stoplight. What we think is that, but chances are we're probably not doing it right if we're still experiencing.
So we're making a problem worse.
Well, we just might not be like helping it if we're
Yeah.
just
Yeah.
doing it wrong. A
And
lot
it's
of people
not going away.
No.
A lot of people will, just squeeze with their inner thigh or squeeze their butt or clench their butt all day. But that's, just giving the pelvic floor a free pass to sleep at the wheel. And,
Oh, wow.
and so, like, listen to me when I say, too, we should be able to sneeze without crossing our legs.
Okay, take note.
Yep.
We-
There you go.
Sex should not be painful. We should not be peeing on ourselves when we're sneezing.
Yep.
We don't have to cross our legs.
That's right.
What about the mommy pooch?
Are you talking about, like, after a C-section?
Yes, because I'm like, is this my life now?
Right. So one thing, excuse me, one thing that they really don't talk about a lot is that we need that scar mobility after a cesarean birth, right? And like that poor abdominal wall stretched and yanked and sewn back together.
Yeah.
And then we see these scars that kind of dive in like a cavern.
That's how mine is.
And then people are like, what is this shelf? But nobody's ever told to move their scar. But those scars, just like perineal scars, need to be able to move with the tissues back and forth. And so those areas can get really adhered and really tight. And not to mention, like, immediately with cesarean recovery, people are often kind of hunched over their scar. It hurts.
Yeah, it does. Yeah.
They have trouble getting upright. And that kind of like little forward flex posture causes everything in the front of the hip and that lower abdominal wall to be tight.
Pooches.
So I usually tell people, like, we want to wait 6 to 8 weeks and we need skin integrity to be great. We don't need any open areas. We don't need any scabs. We need nothing.
So really need it to have
Totally
started to
healed.
grow back together.
Right. We need it to be totally healed. But even those first few weeks, some people don't even want to look at their scar. It can be associated with trauma.
I was about to
It can be associated with a lot of things, and they don't want to look at it.
I felt that way. I
They're
was
scared
like,
to touch it.
what?
Yeah,
Now,
and
do
so
you feel like that's heightened when someone has a classical incision, no transverse?
So the up down versus like across.
Absolutely.
The up down's
Because that is
big.
like emergent, life or death.
Yeah, you really don't see those very often.
Yeah.
I was very
I
lucky
saw
and got
it
it
once
crossed.
in my 7 years at St. Vincent.
Yeah. Often,
And
and I
with
would say
that-
yes, and that is, very disruptive to
Got
the
it.
functioning of the abdominal wall, just
Got it.
as a muscle.
And what even if they're cutting? Like they went the same incision on both my deliveries. So I felt like it got worse after my second.
Well, and that's probably because that scar tissue wasn't mobilized after the first.
Okay.
Right. And so, like, some easy things I would say at first, I would say just start looking.
Okay.
And then, like, those first few weeks and, like, light skin touch.
So almost
like,
just
kind
getting
of
familiar with it.
because, like, that, they cut those tissues and those, sensory nerves are disrupted. It feels numb. It feels weird. And we have to kind of retrain our brain from a sensory perspective of, like, this is light touch, brain. This does not hurt.
Yeah.
Like, we have to retrain
This is
those
safe.
nerves, right? And so, like, oftentimes touching an intact sensory area, like the side of your arm, as you're kind of, like, lightly brushing those lower abdomen around your scar. Even if we have steri strips on, we can't touch our scar.
Yeah.
Even those neighboring tissues. Starting with some gentle kind of back mobility stuff, some child's pose, some cat-cow, some gentle hip flexor stretching can help that area. But the first few weeks, the most crucial thing is the protection of this because, like, having an incision open back up and getting infected and stuff can set you back, and that again is really disruptive.
I think that's harder too if you have an older child.
Yeah.
Oh, for sure.
Because I remember Will running to me and I felt it and I was like, oh my gosh, did this just rip up? And it didn't, but it was just that fear. And then you're just like, I don't want to go.
Well, and
like,
they say, like, don't pick up your kid, but
how can you
you have a toddler and they're screaming for you, or they just
the
fell and they
car
got hurt.
seat. Getting your kid in. I mean, if you have a large child plus a car seat,
yeah,
and it's just you, how are you? You know,
and I think too, like, we could also do a much better job of, like, helping moms with cesarean births in the hospital.
Thank you.
Can I just say that is the only abdominal surgery not seen in the hospital by a physical therapist?
well, yeah.
Like, if you have other abdominal surgeries, like they take a part of your colon out, a physical therapist comes to your room and they're like, let me tell you how to get out of bed. Let's walk down the hallway. But, like,
so you got PT or OT coming to you to help out.
And then with moms, you're like, here you go. Good luck.
Here's the screaming baby. Good luck.
Your abdomen's been ripped open.
Yeah.
Things been moved around. But good luck. So even more probably, I mean, not to discredit our vaginal birth mommies, but C-section mommies, like, you probably needed a little bit more.
Well,
TLC.
especially, immediately.
Yeah.
Yeah.
Right? Like, because, I mean, from what I've heard, I mean, I had vaginal births, but from what I heard, people come in and be like, all right, it's time to get up. And they're like, what?
Yeah.
I can't imagine getting up right now. My ab is killing me. I'm having pain. And even something as simple as like, hey, we're going to log roll and I need you to exhale right before you do that.
They don't tell you that.
It's helpful.
No. They don't tell you that.
Because then we aren't like holding our breath and pushing out against our abdomen, like getting those legs off the bed first and using your arms to push up so we aren't coming from like a full body crunch to try to sit up is really helpful.
Kind of like what you mentioned in that previous episode with the lightning crotch kind of thing. It's like, take your movement in stages. Don't do the quick motions because that's going to hurt.
And exhaling during those transitions of just like gentle exhale. So we
breath,
aren't like holding our breath and doing like a Valsalva when we're trying to transition. And then, you know, kind of getting those upright postures a little faster. And that's where like that abdominal binder in the hospital can come in. Yeah, because then we have compression and we have support over that area. And then, you know, we're told nothing to do with our scar. And then you go back at like 6 or 8 weeks. And then they're like, oh, good. Everything's healed. Go back to what you want. But, you know, that abdominal wall needs re-education.
Yeah.
Just like any other area of the body that would be, I mean, if you have a rotator cuff repair, you have therapy for 12 weeks, no questions. Yeah. But then people are like, I hate the way my stomach looks. I'm just going to start doing all this ab stuff. But a lot of times they're kind of doing maybe not the most appropriate activities for that stage that they're at. And they just end up feeling all their ab work in their back or using their hip flexors. And we're not really getting the abs. And, diastasis recti can be an issue with both vaginal or cesarean birth.
And that's basically where it
the
stays out. Yeah.
Yeah. And it's not ripped, which I think is an important thing to note because people will be like, my abs ripped during pregnancy. And I'm like, they're not ripped. It's the midline is thinned and it's stretched, you know, but like you aren't broken. Yeah. You just need like appropriate exercises. And they're a little bit more after a cesarean birth. Okay. And so then, like, once the incision is totally healed, then we can start with some scar mobility so we get that area moving so they don't try to do exercise and feel incision pain, which can still be happening at, like, 8, 9, 10 weeks postpartum.
Definitely.
Absolutely.
And, I mean, for both, like, if we talk about, like, kind of general guidelines for postpartum recovery, I think 6 weeks to me means we start rehab. And we don't talk about return to sport till after 12 weeks.
Okay, good.
Appropriate.
Take that in.
So, like, that like 6 weeks is the time when we start corrective exercises. And we're talking about cleaning up these imbalances.
Kind of healing.
Yeah,
we worked on our healing in the first 6 weeks. And now we can start working on repair.
Right. And so, like, you know, I hate 6 weeks. All right, go. Yeah. Can I run? Yeah. And I'm like, running is a single leg activity where we're just hopping from one leg to another. And I almost never recommend running before 12 weeks postpartum.
Okay, good to know.
That's
because
huge.
I'm like, everything from 6 to 12 weeks should be like, we're cleaning up all this weakness and imbalance that occurred during pregnancy. And then we are going to make sure that when you get ready to return to run, that it's successful. Exactly. And we aren't just like, hit the pavement, pee our pants. Yeah. Hit the pavement, now I have plantar fasciitis. Yeah. Or IT band stuff. That like, we've restored core strength and trunk strength and that those return to sports successful. Yeah. Yep. And again, you talk about mental health. Yeah. I mean, I think this phase can be really difficult for women because they're like, I want to bounce back. I use exercise to cope or like is this what my body is going to look like and forever. And they try to do stuff, you know, but nobody gives us guidance on like where to start or what exercises are more appropriate. And so it's frustrating. And then they try to do something that makes them feel better. It doesn't work out the way that they want. And then now we've stripped away another maybe coping mechanism that can help with depression or anxiety. Absolutely. And they feel like their body's failing them.
Well, and then you see so many celebrities and things like that where they're, you know, 4 weeks postpartum and either they've lost all the baby weight or they're getting back to exercise. And it's like, I'm over here running on 2 hours of sleep, barely keeping my head above water.
It's being realistic. I guarantee they have this education. I guarantee you their personal trainers or their doulas are there working with them, doing these activities during pregnancy and postpartum. So yes, it's a disadvantage, but we're here to educate you guys, but it's all as much on the level field because moms deserve, no matter where you are in life, you deserve this education.
And there are some like, you know, pretty good like online guides as far as some like postpartum progressions. We have like an early postpartum series on our Instagram page.
We'll link that.
Like really helpful for the first 6 weeks of just like getting those abs engaged, working on diaphragmatic breathing, helping the diaphragm, the abs, the pelvic floor all start to row in the same direction and help each other. I love that. So you can start kind of establishing that reconnection with your body. So I mean, like my goal, hopefully in my life before I die, is that like, you know, postpartum rehab would be the standard of care.
And that's where we come
yes.
from. We love partnering with you because of
Absolutely.
this, because our goal is for screenings and therapy and
Yes.
education for the maternal mental health side of it.
Yes.
But, you know,
Giving mom resources.
that's what our whole goal is. I guess we'll leave on this question. Is it ever too late?
It is never too late. Like,
So-
once postpartum, always postpartum.
What if I'm like 20 years postpartum, my kid is off to college, but I'm still peeing myself?
No problem. I had a patient like that one time.
Really?
She was 22 years postpartum.
Wow.
Stress incontinence. It was a simple coordination issue. Gone in 3 visits.
Oh, my gosh.
You're kidding me.
So she was
That
like,
poor
I
mom
peed my
that has
pants for 20
suffered.
years.
She has suffered for
So
22
it's never too late.
years.
Even like, it's easier just from a tissue quality perspective
Yeah.
if we're like before menopause.
Yeah.
But even postmenopausal, the pelvic floor can
Wow.
be treated. And sometimes these unresolved issues postpartum, come back.
Yeah.
Got
And
it.
menopause, especially more of the prolapse
Yeah.
issues.
Yeah,
of-
and probably because the hormones have an influence
Right.
on that.
Everything's
Right.
kind of
Yep. And
goes
so like,
astray.
yeah. And so sometimes these unresolved issues postpartum are like the incomplete healing will compensate till we lose the hormonal advantage of menopause.
Got
And it's
it.
never too late then. You can get it then too.
So, mamas, it's never too late to get the help you need.
And we're talking, you don't have to live with
Peeing on
yourself, painful sex, your mommy separation pooch here, or just feeling like something's off in my body,
Mm-hmm.
or advocating for yourself.
Or and if you
Absolutely.
feel like something happened and I never recovered, something happened and you never recovered.
Yeah.
Yeah.
Probably, because it wasn't like the right tools or resources,
Yeah.
which can,
Yeah.
be
Yeah.
made available at any stage.
You're never
Yes.
going to go wrong and get it evaluated by
Oh,
someone.
no.
And I also think like, mothering is a very physical activity.
Yes.
Oh,
Kids are
yes.
heavy and they want us to
Yes.
hold them all the time. I still give my 6-year-old piggyback rides
Yeah.
Yep.
every
Mhm.
morning down the stairs.
So even knowing
Nice.
the proper way to do it.
So
yeah.
like strength for the maternal body is crucial.
Yeah.
And we
It
need
is.
that to be able to like keep up with our kids and lift them appropriately and
Yeah.
feel good
yeah.
mechanically. And that's not to be discounted as well. That just
Yep.
the act of mothering itself is freaking physical and hard.
Yeah,
Hey.
it is.
Amen,
It
sister.
is.
Emily, you're a pleasure.
You
Come
are.
back. We'll
That's
have you back.
awesome.
Hey, thank
And we're going to
you.
link all these awesome resources for you. But till next time, guys.
All right, see y'all later.
See ya.
Maternal mental health is as important as physical health. The Previa Alliance podcast was created for and by moms dealing with postpartum depression in all its variables, like anxiety, anger, and even apathy. Hosted by CEO, founder Sarah Parkhurst, and licensed clinical social worker Whitney Gay, each episode focused on specific issues relevant to pregnancy and postpartum. Join us and hear how other moms have overcome mental health challenges, as well as access tips and suggestions on dealing with your own challenges as moms. You can also browse our podcast library and listen to previous episodes at any time. Please know you're not alone on this journey. We're here to help.